This is a global pandemic.
Our common enemy, the coronavirus.
Israel, like all countries, has been greatly affected by it.
Africa itself has responded to this pandemic with urgency and purpose.
From the 1st of April, we will end free symptomatic and asymptomatic testing for the general public.
NATO is more united than it's ever been, and I have no plans to talk to Putin.
For this, Putin will stand condemned in the eyes of the world and of history. He will never be able to cleanse the blood of Ukraine from his hands.
For the first time in history, a health crisis has shut down the entire global economy, painfully demonstrating how inseparable healthcare and the economy have become. Health issues related to lifestyle challenges and changes and an aging population have made this type of healthcare burden more relevant for healthcare systems than pandemics. At the beginning of the 20th century, Barbados was described as the most unhealthy place in the British Empire. A few decades later, it was considered amongst the healthiest of developing countries. In the last two-thirds of the century, there was a series of ongoing developments in education, public health, and hospital services that affected the health status in a favorable way. The revolution in education had a domino effect, and education was enhanced by the provision of university education, starting with medicine at Mona, Jamaica. In 1953, the first public health center was opened, and Barbados now boasted the most modern public health and primary care facilities in the Caribbean. The expansion of training doctors moved to Barbados in 1967 and was an essential ingredient in the medical care revolution. Unlike its pre-COVID era, health authorities have taken unprecedented transformative actions within health systems around the globe. Here is Dean of the Faculty of Medical Sciences, Dr. Peter Adams. He is a product of the Mona and Cave Hill campuses of the UWI. He's a family physician who, after completing his internship in Trinidad, has been practicing medicine for over 30 years right here in Barbados.
I am Dr. Peter Adams, Dean of the Faculty of Medical Sciences. The Faculty of Medical Sciences offers 3 undergraduate programs. The MBBS is a 5-year medical degree. This program is fully accredited by the Caribbean Accreditation Authority, CAMHP, and the accreditation is recognized as comparable to what is done for U.S. medical schools. The other programs are much newer, but also respond to the needs of the community. These are the Bachelor of Health Sciences and the BSc Human Nutrition and Dietetics. There are a number of postgraduate programs offered. We have 10 professional Doctor of Medicine programs which provide training for doctors wishing to specialize in general surgery, anesthesia and intensive care, internal medicine, pediatrics, obstetrics and gynecology, emergency medicine, family medicine, psychiatry, orthopedics, and ophthalmology. We have public health programs, including the Masters in Public Health, which is in high demand. We also have postgraduate programs for nurses and established PhD programs in fields ranging from epidemiology to pharmacology. Staff not only teach but conduct their own research. One internationally funded project is the Ecorn Cohort project. Currently, we have students from several Caribbean countries enrolled in our programs, and we're aiming to recruit international students. Whether you are interested in a taught degree or a research degree, I am sure that the Faculty of Medical Sciences at Cave Hill is the place for you.
Here also is Deputy Dean, Preclinical Sciences and Senior Lecturer in Pharmacology. Dr. Damien Cohort is a Jamaican-born pharmacologist who joined the Faculty of Medical Sciences here at the University of the West Indies, Cave Hill, in 2008. He is currently a senior lecturer in pharmacology at the university and has profound research interests in ethnopharmacology and pharmacognosy. In 2014, he published a book through the UWI Press entitled Medicinal Plants of Barbados for the Treatment of Communicable and Non-Communicable Diseases.
My name is Dr. Damien Cohort. I am the Deputy Dean Preclinical Sciences of the Faculty of Medical Sciences, the University of the West Indies, Cave Hill campus. I want to start off by just highlighting a very important fact, that this University of the West Indies started as a medical school in 1948. 1948 is historic and very significant. This was just after World War II, when war had essentially crippled the world and its resources in important areas such as healthcare, national security, and other important elements of daily life. 74 years after, the university is still relevant. It is still relevant as a primary institution in the Caribbean that looks at the development of our healthcare systems, building our healthcare resources, human resources, physical resources, and conducting very important research to continue with the bolstering of our healthcare systems. Here at the Faculty of Medical Sciences, UWI Caveville, we have programs at the undergraduate level and the postgraduate level, which essentially allows the university to bring forth its mandate. So join us as we deliver our mandate to build and bolster our healthcare systems and create not only the future that you want for yourself, but for generations to come.
The long-term impact of COVID, unfortunately, is a reality. But for this young lady and family, it has brought them even closer together.
Sometimes I breathe a sigh of relief and I say, Lord, thank you that I am here in Barbados. I think as a population, I might not be in the medical field, but administrators and the policy makers, they need to start moving, I'm assuming, to a position where things will not be like 10 years ago. Because overnight, we heard of a war. I went to bed Wednesday night and Thursday, the news plastered with an invasion in Ukraine. And looking at the analysts, they're saying that there will be a trickle-down effect, that this war in Europe, so far away, will have great consequences for us here in Barbados. So I think we need to start thinking outside the box as well. Being sick with COVID make me appreciate the healthcare system that we have here in Barbados, because as I mentioned before, I'm not Barbadian. So I felt a tinge of gratefulness that I was here, where you can see thorough planning. I know that the symptoms will be unique to every person, but for me, I was very fearful. I had problems breathing. I am not asthmatic, but every gasp was laborious. It seemed as if I had to make a deliberate effort to breathe. And I remember lying at night in the bed while I was in quarantine, or isolation rather, and thinking, if I were to go to sleep, how would I breathe? I am Rashona. As I reflect on my journey after COVID, I think I have gained a new perspective and a greater appreciation of life.
The University of the West Indies Caveville campus continues to support its very rich and deep traditions of nurturing students into competent and world-class professionals. We take a look into the engine which drives its consistent success and its evolution. The Faculty of Medical Sciences has had many success stories.
My name is Heather Harewood. I am a lecturer in public health and epidemiology and the head of public health at the UWI Caveville campus. I am also the program coordinator for the MPH, the Masters in Public Health, and I'd like to tell you a bit more about that program today. Let's start by considering the premise that the strength of a healthcare system really depends on having a well-trained, skilled, and agile workforce. And this was one of the reasons that led to the development of the MPH here at Caveville, because it was in response to an expressed need by the heads of CARICOM to have a program that would seek to increase the capacity for leadership and management within public health. The MPH program has really attracted persons from a wide variety of backgrounds. So in terms of matriculation into the program, we accept candidates who have degrees, undergraduate degrees in health sciences, in biological sciences, and social sciences as well. We also accept persons who might have relevant professional qualifications, whether it is in nursing, environmental health, physiotherapy, or any allied science, along with the numbers of years of experience. So for persons who might not meet the strict matriculation criteria, we're always happy to peruse CVs, we're happy to peruse applications, because persons still may be eligible to undertake this program here with us at Cave Hill. So we're encouraging you to consider the MPH program. It is a program that really attracts people from across the world. So we've had persons from Belize in the north to Guyana in the south, if you're looking at the Caribbean region. But we see ourselves, yes, as a hub for the Eastern Caribbean, but we have had candidates who've joined us from beyond the region. So we've had persons from Canada, we've had persons from Nigeria, and even Denmark take a course of study with us at the MPH in Cave Hill. So we do look forward to you considering the MPH program. We encourage you to, because you can see where the MPH program can take you in terms of your career path. It also acts as an opportunity for you to develop part of a network. A lot of the work that we've done with the MPH graduates has really, made a mark in our community. So we invite you to join us on the MPH, and we look forward to welcoming you next semester.
Nurses with advanced skill sets are in high demand to fill current and emerging leadership roles across the globe. The Faculty of Medical Sciences has introduced recently the Master of Science in Nursing program, which has groundbreaking implications for healthcare, the nursing profession, and nursing education. Here's Dr. Wendy Seeley.
I'm Wendy Seeley, Program Coordinator of the Nursing Programs at the Faculty of Medical Sciences, University of the West Indies, Cave Hill campus. These programs are the Master of Science in Nursing program with specializations in education and administration, and the most recent addition, the Postgraduate Diploma in Pediatric Nursing. The latter program commenced in September 2021 and is the first activity of the collaboration with the Shaw Center for Pediatric Excellence through the Sick Kids Global Center for Child Health and the UWI Cave Hill campus. This training is the first of its kind in Barbados and the Caribbean region, where 38 nurses will be afforded the opportunity to enhance their knowledge and skills in this major subspecialty in nursing. The curriculum is centered on pediatric nursing competencies relevant to nursing care both nationally and internationally. Graduates of this program will apply the best current evidence of knowledge synthesized from critical analysis and theoretical concepts to deliver safe and professional pediatric nursing care. They will utilize critical thinking skills and professional judgment to inform decision-making to assess, plan, intervene, and evaluate plans of care for management of pediatric conditions. To advance the discipline of pediatric nursing, graduates will advocate for children and their families and initiate evidence-based quality improvement activities based on priorities related to nursing practice and child health. Specifically, the aims of the Master of Science in Nursing program as follows are: provision of a state-of-the-art center for scholarship, research, and clinical specialization, preparation of motivated nurses for leadership within the healthcare and related services of the region and global economy. We encourage you to visit the nursing program sites on the Faculty of Medical Sciences website, the Master of Science in Nursing, and the Postgraduate Diploma in Pediatric Nursing. As the coordinator of these programs, I'd like to make that your reality. So join us here at Cave Hill.
In Part 2, we continue to look at the newer programs to the Faculty of Medical Sciences here at the University of the West Indies Cave Hill campus in Barbados.